Okay. Hello, everybody. Thank you for coming. Today we have Dakota with us, and we're going to be talking about one of our five forces that we've kind of been building upon this past year. Today we're really doing a focus on mental health. Um, and we are going to do a quick grounding. I'm going to do a little bit more of an in-depth introduction of Dakota, and we're going to have a discussion, do some Q&A, and then we're going to end. And so thank you all for coming. I'm going to wait for like 2 more minutes for the live stream to kind of get going. But yeah, if you're on time, thank you. Okay, so it's been around 2 minutes, and I think we can get started. So again, everybody, welcome, and thank you for joining this conversation about mental health and mental illness. Especially, I think during these times, it's really important to acknowledge the importance of our mental health and learning more about it and educating ourselves and having experts to talk to, especially within the GVP space. So, before we get started, I kind of want to ground us and talk about why March for Our Lives is doing this, because some people may think that we should just be talking about GVP, but and gun violence prevention. But there are so many intersections in this issue, mental health being one of them. And so, doing these teach-ins are actions that help us build power within our communities, because knowledge is power, and utilizing teach-ins helps us prepare as student organizers and activists for the battles to come. Um, and so we're excited to take a page from the organizers before us and prioritize education as we look to end gun violence. Our theory of change is rooted in the education of ourselves and our communities. This is our community. So we invite you to lean in, listen, ask questions, take notes, and really immerse yourself in this hour or so of deep conversation and education. Also, we are talking about mental health. And so if anything seems overwhelming, triggering, I want to acknowledge and give the space in the words to say that this is a safe space. And if you're feeling overwhelmed, if you really want to learn, but you're feeling yourself getting anxious, um, feel free to leave, come back. Remember to take deep breaths. It's important to educate yourself, but it's also important to take care of yourself. So do whatever is needed for that. And with that, I am going to just go straight to our panelist, Dakota Jablon.
Either
Oh,
way, everyone, it's totally fine.
sorry about that. But
No worries.
Dakota is an expert in mental health within the GVP space. She's been working with CSGV for the past couple of years, since 2016. Um,
2017.
2017.
I always forget to, no worries.
On suicide prevention and federal policy. And let me know if I missed anything, Dakota, but I wanted to give you the space to introduce yourself because you've done a lot. And my pandemic brain could not memorize it all. So
No, don't worry. You covered pretty much everything. Hi, my name's Dakota. I'm currently in Los Angeles, but live in Washington, D.C., but I'm an LA native. Um, and as Kelly said, I work at the Coalition to Stop Gun Violence, where I'm our Director of Federal Affairs, as well as our Suicide Prevention Specialist. I really got involved with the gun violence prevention movement because of both mental health and suicide prevention. I studied at Johns Hopkins School of Public Health, where I got my master's in the mental health department in their School of Public Health. And so it's incredibly important for me to talk about suicide prevention, to talk about mental health, and also talk about how we need to make sure that there's the difference between mental health and mental illness and not unfairly stigmatizing individuals like myself who have mental illness when talking about solutions to gun violence.
yeah, as somebody with mental illness too, I really appreciate you saying that. For those who might not understand, could you tell us your distinction between mental health and mental illness?
Yeah, so I can kind of explain also for my own mental illness. I have major depressive disorder, which is a clinical diagnosis within this large book that's called the DSM-5. And so it is something that I'll have the rest of my life. I've had it since I was younger. It's part of who I am. But that doesn't mean that I'm a dangerous person. It doesn't mean that I'm an elevated risk for violence. And I think, a lot of the time when there is gun violence, people want to see what is happening, what is the reason. There's some sort of weird alert right now happening. I'm sorry, in case you can hear that in the background. But so people want to know, why did someone, commit a mass shooting? Why did this happen? And oftentimes, unfortunately, we've used mental illness as a scapegoat. And, thinking, oh, if they, just were institutionalized, or if they weren't in society, if, usually it's serious mental illness such as schizophrenia or bipolar disorder that get kind of thrown under the bus. But all the research has found that people living with mental illness are rarely more likely to be violent than others. It's actually, they found that it's only about 4% attributable to violent crime. So we know that, even if mental illness disappeared tomorrow, we would still have our gun violence problem. So that's really important to know when we talk about mental illness. I was watching a hearing today in the Senate Judiciary Committee where mental illness was brought up, that, we just need to ban people from having guns if you have a mental illness. And that's not only not based in fact, but it's also harmfully stigmatizing to individuals like Kelly and I. And so I think it's important, a few years ago, I didn't speak openly about having a mental illness. And it was really coming to this space and feeling like I needed to show a face of someone, I'm not a monster. I'm not more violent. I'm not dangerous. I just, there's something that's different with my brain, and that's okay. But we do know that there's, when we talk about our mental health, and I think we've come a long way, even since I was in high school, and I'm still hopefully relatively young. I'm not 30 yet. So not even that long ago, how far we've come with the mental health conversation and how it's important to take care of your mental health as well as your physical health. And so when we think about, trauma, we know that trauma is harm, can hurt your brain and can make you more aggressive, or, lead to retaliatory cycles of violence and other things like that. We know that there's, you can get help for that, but that doesn't mean that you have a mental illness. Same with, being an aggressive person, not having the coping strategies to deal with anger or anything of that nature. That's all part of like behavioral health. And you can have good mental health, good mental hygiene, and never, or bad mental health and bad mental hygiene. There's kind of trying to explain these like circles, right? So right now I have a diagnosed mental illness, but like I've been to therapy for so long, I have good coping strategies. And so right now my mental health is strong, even though I still have a mental illness. Just like there are people who have, poor mental health right now, but they don't have bipolar disorder, they don't have schizophrenia. And so I think it's really important when we talk about it to make sure that we are being careful with our language and making sure to not stigmatize individuals with mental illness who are continuously thrown kind of under the bus and are already struggling with many things, trying to just get, mental health care that is, affordable, amongst other things. And so I just gone on probably for too long around this, but it's just something I really care about. And I think the gun violence prevention movement has done a lot better in this space, but it is something in the GVP history of, unfairly talking about people with mental illness. And so I think it's just really important as new advocates come into this space. The media still talks about mental illness as the cause of gun violence, and to be very upfront that it's not the cause.
No, yeah, that is like a light bulb went off in my head whenever you were talking about this distinction about like being somebody who has a mental illness, but also having good mental health. I've like had that feeling before, but never knew how to put it into words. And it kind of reminds me of something that I learned a bit ago about how people with mental illnesses tend to be the ones who are killed instead of the ones who are killing. And I think that distinction is so important for people to remember. And you've already kind of touched on this, but where do you see the intersection between mental health and gun violence? You've talked about how there's kind of been like this history within the gun violence prevention space. So kind of seeing like how this space has grown when talking about mental health, and also like where we could grow.
Yeah, I think one of the big things is it's really important to be a good ally to the mental health community and the disability rights community. And it's something that I'm really proud of having been able to connect with and, call friends and colleagues from organizations like NAMI, Autistic Self Advocacy Network, the Bazelon Center, and seek out those partnerships. And I think for a long time, they were not really connected with. I know my boss, Josh Horwitz, was starting to do that. He'd been in the movement for a long time. And in 2013, he really started to make those connections. And I'm really proud of the work that we've done. And I think other organizations are starting to get there too, because we need to talk to people and hear from their perspectives. And so, also look at the research. I think now that people are doing that and realizing that mental illness is not the cause, but also hear from these groups on how it's harmful, of how, politicians who may be on our side on this issue are talking about it. And so CSGV has held multiple forums on Capitol Hill for staff and legislators with mental health groups to kind of come to have this conversation together as opposed to being siloed. I think the other important thing is talking about suicide prevention. And, we know that mental health is, having poor mental health can increase your risk of suicide. But it's also important to know, and the suicide prevention field is really kind of coming to this space now, is that suicide prevention is a public health issue. It is not just a mental health issue. And so while having a mental illness, especially depression, does increase your risk of suicide, they've now found that it's actually about half of all people who die by suicide have a mental illness. And that's why, addressing access to lethal means is so, so important, because we can't figure out if everyone has mental health issues or mental illness in the millions of people that are attempting suicide every year. And so that's why kind of other strategies help, as well as just addressing the root causes of why someone may be suicidal. So we know that, the CDC has this great report, which I highly recommend, on the public health, approach to suicide prevention. And we know that there are strains on mental health, but that are not from a mental illness. So like having any economic issues increases your risk of suicide, which when you think about it, you're like, oh, that makes sense. If you can't afford where your next meal is going to come from, your mental health is not going to be doing so great. But that doesn't mean that you need to necessarily go to therapy for that. It means that you need to have a good paying job, or the government needs to help you, get stimulus check in some way or form. And so figuring out why there are these other root causes is really important, and thinking about it in a holistic manner. And again, back to what we were saying before, this kind of difference between mental health and mental illness in that space.
Yeah, I love what you said about like the systemic issues going into mental illness. I feel like a lot of times people try to isolate mental illness and mental health as like a single issue, but it's a symptom and it's caused by so many different things. Like if you don't have resources to take care of yourself or your family. And on that note, I want to get into the policy, but I also wanted to ask you if you know any other like systemic issues that affect people's mental health that people should really be aware about and think about when addressing mental health and making strategies for it.
Yeah, definitely. I think one of the big things right now is racism, which, I feel like for so long wasn't talked about. And luckily, it's just starting to get into the suicide prevention space. There's been leaders who have been talking about it for a long time, but it's finally becoming a little more mainstream. And that's because before, probably like 10 years ago, even like 7 years ago, being Black was actually a protective factor for suicide. So for when you look at like demographics, it was Native Americans and white men that had by far the highest rates of suicide. And being Black was actually, for some reason, protective, that population was less likely to attempt suicide and die. And unfortunately, within the last 5 years, that has really changed. And we're still waiting for final 2020 numbers, broken down kind of by demographic. But what we've seen in places like Baltimore City, there was a study done by Paul Nestat from Johns Hopkins, and found that within Baltimore, I think it was actually within Maryland as a whole, that the suicide rate overall decreased in 2020. But when you looked at the data, it was just among white people, and it actually dramatically increased amongst Black people. And you think about it and you're like, okay, it's probably, maybe partly because of COVID, but what happened in 2020? This racism and racial injustice was brought to the forefront. And that's really, really important to think about, to talk about. And that if we want to actually prevent suicide in this country, and we want to prevent, forms of community violence, I think important for gun violence prevention as a whole is addressing systemic racism. And I just want to highlight and I can try to find the links and share them after, but two really good reports on this. First, the Congressional Black Caucus 2 years ago, maybe a year and a half ago, released a report on youth suicide. I think it was specifically amongst Black youth, but it might have been Black male youth in particular, which kind of got this going. And they actually required that the federal government, HHS, SAMHSA, and I think NIMH maybe kind of do a report to Congress on this issue. And so that was recently released. And they, list a whole bunch of things of what can help to prevent suicide among this population, what we're seeing with trends. And in addition to addressing systemic racism and all of those things, I just think it's important to highlight that in that list is also addressing access to lethal means, because we know that when the firearm is involved, you're not given that second chance, whereas other methods for suicide are way, 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 way less likely to be fatal. And so even though, that's not going to stop someone from suffering and addressing the root cause, it's going to give that person time to address those root causes. So it's kind of a first step in the suicide prevention space. So it's both I always say like the why and the how are super important for suicide prevention efforts. Sorry, I went off on a little bit of a tangent at the end.
No, don't have to be sorry at all. That like
Very
those.
passionate about this topic, if you can
No,
tell.
yeah. I'm glad somebody who's passionate about it is working in the space. But it's so jarring to hear like those stats and those numbers. And um, it's so unfortunate that I feel like some people like sometimes a connection that just isn't made. Like, oh, like racism may lead people to to bad mental health, as like an Asian American person with COVID and everything going on. Like, I can see that impacting my community directly, and so I want to thank you for addressing that. And
Yeah, and I would just say on that point too, I think that's one of the things I'm, really going to be looking for, but in an alarming way, especially with the Asian American community. Asians as a whole have the lowest rates of suicide in the United States. But because of how we have treated Asian Americans during this COVID pandemic, and at the same time, I know in California, there's reports of an kind of gun surge, first time buyers that are Asian American. I'm terrified to see what those numbers are going to come out with. And it's, I don't think our country's doing enough on that. I know we're trying to, maybe some politicians are trying to, but that's exactly, any marginalized community is now becoming extremely at risk for suicide. It's long been, LGBTQ, especially transgender individuals, have very, very high rates of suicide attempts. And I think, we're now seeing that with other demographic groups who are being marginalized and, experiencing just unprecedented, I would say, discrimination and violence. And I think exactly what you said about Asian Americans are, there's a long history, especially again in my home state of California, of that discrimination. But I think we've seen it really come to light within this last year. And, on our social media, people who maybe aren't experiencing themselves are seeing people that look like them experience it, which is also, hard on your mental health. Even if you yourself, I'm trying to remember this word that I read in research. But even if it's you yourself are not experiencing it, but you're seeing people like you experiencing that, there's like this collective trauma that comes with it.
mhm. Yeah, for sure. I felt that. I feel it. And on the topic of COVID-19 and the pandemic, um, I you basically just touched on it again, but how has your work been affected by the pandemic personally? And just as you've been talking about, like the numbers, how the demographics have been shifting, just yeah, the impact of COVID-19 on this crisis.
Yeah, something I'm a huge data person. And so one of my biggest frustrations is that we don't have really timely data, especially when it comes to suicides. And so we've seen using kind of national reports and the Gun Violence Archive that gun violence just dramatically increased in 2020 for a whole host of reasons. And I think, part of it's both COVID, it's both because of police brutality, there's, you know, economic uncertainty, isolation, all of these things, perfect storm kind of thing. But what's frustrating is that we have the national suicide number for 2020, but have no idea what that is broken down by method. So we have no idea if the firearm suicides went up or down. We have no idea specifically amongst demographics, male, female, Black, white, Asian, Native American. And so I'm frustrated because I want to know. And I think it's so hard to actually advocate in real time for what is needed when you don't even know who is the most at risk. Where do those resources go? So I think, unfortunately, I think we're going to, unless a lot is done, especially with discrimination and racism, that this crisis could just get worse, right? It's not that this, as COVID is slowly, somewhat disappearing and we're getting vaccinated and going back to our lives. That was just one issue that happened in 2020. And so I think that there's a whole host of things that need to be addressed. And I think, it's been a hard year for everyone's mental health. And there is this theory that for suicide purposes, that, everyone kind of going through this collective trauma in a sense of, under lockdown, not seeing loved ones could have been a protective factor because you don't feel so alone because everyone is kind of going through something. But I think, and so that might be why the raw number and rates slightly went down overall in 2020. But again, that's just suicide overall, not by firearm specifically. But I think what's hard is now some people are kind of coming out of that, right? Some people are able to get vaccinated and have their jobs and go back and travel. And a lot of people, that's not the case.
Mm-hmm.
And I think that's what's really alarming is the disparities are just going to keep getting worse within our communities and the long-term mental health effects of that, which could lead to long-term rates of suicide increasing amongst certain populations, um, increased of community violence, domestic violence, all of these. It's a public health issue. There's not one single cause. It is all of these things working at the same time. But we've seen a lot of things go wrong in 2020. And I think when I watch the news, it's all kumbaya, things are getting better. But then, you have to pay attention of, is it actually getting better for everyone or just people that look like me? People who have jobs that are white that, didn't luckily lose anyone to COVID. And I still struggled with mental health during the last year, but I know that people who look like me are not having the brunt of this issue by any means. So again, went off on a slight tangent, but I think that's kind of exactly why we need to address 100% the mental health. There's the effects of mental health, but as well as the causes of what is harming people's mental health.
No, yeah, that, I'm sorry if you could hear that. I think there's like a squeaking noise going on. Okay, but if you can't hear it, that's great. But I think that was like so important to address, especially seeing the statistics about who's getting vaccinated, what kind of communities are being prioritized. And it makes so much sense to like have that connection between that, like the populations of people who are getting vaccinated and who and aren't, and how that is affecting people's mental health. Um, and Okay, I got a notification that I could start the Q&A section. So if anybody watching has any more questions, um, please submit them right now. And yeah, while we're waiting for people to have any questions or comments, I hope we get a few comments about how great you've been, because this has been so informative, but also digestible, which I think is so important, especially in like a youth space. And while we wait, I want to ask, what actions can young people take to combat mental health stigma and mental health inequities?
That's a great question. I think the first thing when it comes to stigma is openly talking about mental health, which I think is really hard. Again, I'm a young millennial, the opposite of elder millennial. And so I think it's interesting my own experience looking back in high school when I was struggling with mental health and mental illness I had to take a leave of absence from school, and how I was shunned. Like I was completely lost all of my friends. I had known these kids since in elementary school. It was such a taboo topic. And just completely, like I switched high schools because I needed a fresh start after I had gotten the help I needed. And I'm just so impressed with the next generation, which are, I think I'm literally on the brink of it. So like 3 years younger than me, and seeing like people's videos talking about mental health. And I like have family members that are younger. I'm like, how did this, I'm just in awe that people are really talking about it. Because that was just not the case right before this with my experience. And interesting, like talking to so many of my friends now, again, I didn't talk about it in college. I take medication for depression, and I would lie in college and say, oh, this is stomach medication, because I was so embarrassed. So it wasn't until I was in my mid to late 20s that I even talked about it. And when I talked about it, other people would be like, oh my gosh, me too. I haven't told anyone. Or, oh my gosh, my dad struggles with mental illness, or my mom does, or my family member does, or I've lost a friend to suicide. And it was me talking about it that made other people talk about it. And friends that I'd had for years, so many of my friends in college, that we never talked about it. And then all of a sudden I was like, oh, this whole time I wasn't alone. And so that was, when I really was struggling. I think that was the hardest part, is I felt I was the only person that this was happening to. And so I think one is just which I think this generation is so much better, but being open to talking about it. And there's nothing to be ashamed from with this. Being open to asking for help if you need something, asking your friends, asking your family members, asking a counselor, asking, your doctor, that just being open about it. And then the other thing on battling stigma, and this is something I really try to do, is when you hear anyone talking, blaming mental illness as the cause of gun violence, which is my personal like nails on a chalkboard thing. being confident enough, comfortable enough to push back on that. And it's uncomfortable. I've had to do it to literally members of Congress before. And it's uncomfortable, but I, say, hey, actually, that's not the cause of gun violence. And, it's really important that we respect individuals living with mental illness. And sometimes I'm like, hey, I have a mental illness and I'm not more dangerous than someone else. And I'm not the next mass shooter. And I shouldn't just be barred from having a gun because of my medical record. And so I think being able to push back on that, and it is really challenging. And again, something I didn't do until relatively recently, but using your voice, and especially people really listen to young people right now, I think. And so using your voice for good is really important. And I forget the second question.
Yeah. It was along the same, huh?
There was the stigma, and then there was another part of the question.
Yeah, it was like mental health inequities, which I think
So that is a huge issue, and I don't have a solution. Long story short, it's a huge issue. And it's something that I learned a lot about in grad school. It's what made me actually really interested to go into mental health is, when I was in high school, as I said, I'm a suicide attempt survivor. I had to take a leave of absence. I got the best medical care I could have gotten because my parents could pay for it. It wasn't covered at all by insurance. This was before mental health parity. So because my parents had the honestly financial resources to afford that, I was able to get the therapy constantly, not just once a week, like multiple times of therapy. I was able to go to the best doctors. I was able, my mom was a stay-at-home mom, so she was able to stay with me when I was at home and couldn't get out of bed. I realized, oh my gosh, I'm, one of the few people that's happening to, right? Like that's not normal. And even now, my health insurance at one point wasn't covering my full medication, and it wanted to be $600 for a month. And I'm like, I don't have $600 to pay. And luckily I was able to figure it out. But I think that, just shows I'm someone who really I'm very privileged in this space. And I'm very privileged that my family also did not subscribe to mental health stereotypes. And so they didn't think it was all in my head. They supported me. And so that's another, issue. But I think the inequities is there needs to be a whole lot more money going into mental health and making sure that it is accessible and paid for by Medicare or Medicaid, anything and everything. It should be free at community health services. And then the big, big thing that we are also absolutely terrible on as a country is having kind of culturally informed therapy. And so, again, I'm white. And so my therapist was white, and it wasn't hard to find a white therapist. But it's really important to have someone that you trust that looks like you, or that you feel comfortable sharing your experience. And I know that there's a ton of research on this of like people feel more comfortable going to someone who kind of has a similar background as them. And unfortunately, I know just again from someone else's lived experience, where oftentimes someone who is a person of color will become the kind of catch-all for anyone. And so even if you, are an Asian provider, anyone who is not white, they'll give to you. And it's like, okay, but that person has a completely different lived experience, than me as an immigrant. I should, I can understand the immigrant's situation. I'm speaking of someone who had that situation and that experience, but she doesn't know what it's like to be a Black man in America. And that's a different type of thing. And you don't want to spend your time in therapy explaining what it's like to have that lived experience. And so there's really a need for that. And funding is so important. And our mental health system in this country is so vastly underfunded. And it's what I wanted to originally go into. And then I realized I hate econ. And that is why I could not do it. So if there's anyone out there who likes econ and cares about this, we need people like you. I just could not do it. But I personally think that there is no bigger need right now. And we're seeing that to actually invest in a mental health care system that works and that is not just designed for white people. But we have a lot to do in that space.
Yeah. Seeing like how the mental health space like reflects just like the overall medical space, you know, like medical racism in general. And then it's so applicable in the mental health space, especially because it is a predominantly white, wealthier space. I've been very fortunate to find somebody who has the same background as me, who's an Asian woman, as my therapist, and that has been life changing. And I have so many friends who unfortunately like go to free resources like at my university, but there's only, as you said, like one BIPOC person, and that they cannot address every single need of every single marginalized student. If I can reemphasize this at the end, but there's a really good directory called like Inclusive Therapist, which I use to find my
That's
Asian
amazing. I didn't even
therapist.
know
Yeah.
about that.
Yeah, and you can kind of like put in what you're looking for, and then hopefully you'll be able to find someone in your area. But yeah, it was so important for me to find somebody that was Asian and identified as a woman, and it's been so just like transformative in my mental health journey. Um, but on inequities and the youth, to what extent do you think a lack of mental health resources and support in schools may have on the school to prison pipeline?
Oh man, that's also an issue. Yeah, I think, again, for living my personal experience, I went to a public school in a really affluent area, and I don't even think we had a counselor. Maybe like a school counselor. I don't know. No one flagged me. No one talked to me about my own mental health issues when I was in school. And so if that's how it is in a nice suburb of Los Angeles, like I always think how much worse it is anywhere else. And I have friends who are teachers who work, in Title I schools. And these kids, I mean, it's awful, in addition to, potentially going to school hungry for one reason or another, to having, maybe a parent who's, experiencing that they're, in prison or for whatever reason, right? There's all of these different issues that are at play. And if there's not even someone to talk to about that at your school, like it's important, even again, even if you don't have a mental illness, it's important to talk about what you're feeling and getting those skills to deal with it. That's again, speaking just for myself with COVID, I feel like I did better than some of my friends handling it because I'd been in therapy for 15 years. And so I'm like, oh, I know exactly what to do
Hmm.
if I have stressors, right? And so that's so important. And I know in Baltimore City, they've tried to implement like mindfulness for young kids instead of detention and things like that. And I think they're doing research on how effective that is. But there is absolutely a need for actual psychologists and or social workers, anyone who has that kind of counseling background. I'm slightly biased towards social workers because I have a lot of some friends that are, and I think they're great. But your money should not be going to school resource officers. Your money should be going to someone who is a caring adult and that can help you figure out those coping skills. And I also am a huge proponent of like universal interventions. And so starting that at a young age of starting mindfulness or other, how to talk about your feelings, who to look for help, starting that in kindergarten. I actually wrote a paper about that in college on, the importance of doing that. And interestingly, some European countries do that, where they talk about mental health. And that's a whole thing you learn about just like when you learn about physical health in school, um, when you learn about like the reproductive system, they also learn about the mental health system and what you need. And so there's things like that that are needed. I know, just a plug, there's the mental health first aid, which I think that you might be able to take it starting in high school. I'm not exactly sure, but I know that, that's helpful for people. Even if you're learning about how to help others, you learn how to help yourself in that. There's this program called the ADAP, Adolescent Depression Awareness Program, that was developed out of Johns Hopkins and also has been found to specifically help prevent suicides. But it's really like spreading awareness, helping get the resources out to communities, and helping students know who to talk to. Um, but again, there needs to be funding for that. And
Hmm.
it's, I mean, as we know with the education system in general, it's not happening.
Yeah, yeah, yeah. I don't think even in my school we had like any sort of like social worker, somebody who was like really working in mental health, and people were struggling. My peers were struggling. I was struggling. And then all I had was really like a college counselor who had the title counselor. And I also went to like a more like predominantly white area, etc. And I can't imagine like and and these kids, these privileged kids, like we were taken care of anyways. Like it wasn't like they weren't going to call the school resource officers on people, etc. But it is a real issue, and it goes into all of the systemic inequities, all of the stigmas that people associate with mental health and with like race and especially now, I think being a young person growing up in this world with the climate crisis and all this, and I think if we can get that funding, that'd be great. If we have more people like you working in this space and really, really caring, I think people go into things and like for different reasons, but for in the mental health space, I feel like it's really important to have people who care. I know my therapist cares about me well, um, and so I'm happy to have someone like you going into policy and working on suicide prevention. And yeah, with that, um, we can wrap up. We are going.
One more thing. I looked it up in the background awkwardly because I wanted to make sure I got the link right for
Yeah.
this. But I do want to plug this really amazing resource, and it is specifically for Black youth or Black people who might be struggling or just want to talk about mental health and learn more about it. It is a YouTube channel. It's called the Black Mental Wellness Lounge. I can put it in the chat. I don't know. Maybe you guys, I don't know if it'll show up or you guys can do something with it. But it's been created by, his name's Brandon Johnson. He's a subject matter expert in mental health. He also is a Hopkins alum who did the same program as me. But years before, this channel is, it's really amazing the work that he is doing, I think, to really spread awareness about Black mental health and trauma and self-care and racism and discrimination and therapy. And, again, this is specifically for people who are Black, but I think, even as a white person, it's been very informative for me to watch these videos. So highly, highly recommend checking that out.
Okay, thank you so much. We're definitely gonna try to send that out. And yeah, before we like completely end, do you have any like advice, parting words, anything for the people watching that you would like to say?
Yeah, I would say, thank you first for being interested in this. I'm so appreciative for March for Our Lives for taking this on as an issue. I think, I always say also when we talk about mental health, it's so important for people to talk about mental health, not before a shooting happens, but after, like the trauma and like we were saying before of this collective trauma of just growing up in a community, disproportionately impacted communities who are experiencing community violence on a daily level. Even if you yourself have not been a victim, you probably know someone that is, you might be afraid of walking home. That is collective trauma. And that's what needs to be really addressed. And there needs to be resources that are going into that. And so whenever, politicians are pointing to mental health, or specifically mental illness, and barring anyone with mental illness from, ever purchasing a gun, it's really, I try to pivot to, okay, but what about after someone has survived or their someone who's dies, their family members are going to have to live with that the rest of their life. And so mental health is really important for that perspective too. I'll also just shamelessly plug this. It's on the suicide prevention front. So it's connected, but slightly different. But we have a website called preventfirearmsuicide.com that really outlines firearm suicide prevention, kind of answers frequently asked questions about it, a ton of resources. It's really only addressed again for the how and not the why. We acknowledge on the website, this is, we're talking about the method, the how, and there are other resources available to talk about the why of suicide. But we try to update it frequently, and it talks about different policy interventions that have been shown to prevent suicide. So if you're interested in learning more about suicide prevention, kind of from that gun violence prevention space, highly recommend checking that out. But otherwise, I think, take care of your mental health, take care of your friends, make sure, especially right now, check in on them, especially for friends that are living alone. Really but check in on everyone. I think, again, I'm so impressed with Gen Z on this, but millennials have a long way to go, I think. But really being open to talk about mental health. It's something I always say, mental health should just be as important as physical health. It's all health, and they should not be thought of as separately. And also there's a whole connection of mental health and physical health. It's a topic for another day. But yeah, just reiterate the importance of it, and really thank you guys for giving me the opportunity to kind of talk, and hopefully people learn something. I know it's just my experience, but happy to kind of share what I've been through and what I've seen.
No, yeah, I definitely learned a lot. And I consider myself kind of well versed on the issue, but I was like, I was like, whoa. The emphasis on community, I think, is so beautiful and so important. We gotta have each other's backs. Like we gotta have each other. And I think, part of the solutions is doing those community-based solutions, really catering to community and what's needed culturally. As we talked about before. And yeah, I just want to thank you so much for touching on literally everything that could possibly be touched on. And like, yeah, not everything, but like a
No,
lot.
I can chat for all day, so hopefully people didn't get sick of my voice.
Oh no, yeah. Like for 15 minutes, like just we touched on so much. And I hope that people are able to like look back on this live stream if they need more information. Again, we're gonna send out the resources that were mentioned. Um, so important right now to take care of yourself. And I know that's easier said than done. And mental health is more than self-care. It's more than face masks. Um, it's more than taking a bubble bath, even though those things are nice. But yeah, it's something that I have and have learned to cope with. It's something that a lot of people have learned to cope with. And it's nothing, um, it it does not deserve to be as stigmatized as it has been, as you're saying, Dakota. So yeah, on that note, I want to tell everybody to be kind to themselves, especially after like a lot of heavy subjects were touched on. So remember to breathe, to do anything you need to do. Have a nice meal, talk to a friend, get that connection to your community and to your loved ones. And yeah, thank you for joining. And thank you, Dakota, so much.
Thank you. Thank you so much for having me. It has been a blast.
Okay, bye, everyone.